In LA Sierra Tarahumara and Chihuahua, receiving medical care can mean walking for hours, traveling along difficult roads, or waiting days to find transportation. In some communities, people may go months, or even years, without regular access to a clinic. It is estimated that nearly 60% of indigenous children show signs of chronic malnutrition, and that approximately 75% of residents face serious barriers to accessing medical services. In LA Sierra Tarahumara, only 2 out of every 10 people receive timely medical care. The shortage of doctors, the vast distances, and the lack of medicines prevent timely diagnoses and interrupt the continuity of treatment. Here, an illness that could be treated in time may become more serious simply because a person lives far away. For many families, seeking care means leaving their community, spending resources they do not have, and facing a journey that may also put their lives at risk. Distance should not decide who receives medical care and who must continue waiting. In response to this reality, a pilot program was launched in Chinatu, in the community of Guadalupe y Calvo, demonstrating that there is another way to bring healthcare closer to the people who need it. A telemedicine module equipped with TytoCare technology was installed. This device makes it possible to conduct remote clinical examinations and assess the heart, lungs, ears, throat, temperature, and skin. Trained personnel assist the patient within the community, while a physician evaluates the information in real time through a video consultation. In just 7 months, more than 500 medical consultations were conducted. People who once had to travel for hours were able to receive specialized care without leaving their community. The model also includes access to essential medicines, patient follow-up, and continuity of treatment. This pilot program represents more than technological innovation. It represents time regained, expenses avoided, and illnesses that can be detected before they become emergencies. Chinatu has shown that when medical care can overcome distance, an isolated community is no longer alone. Building on the results of this experience, the Health for All project seeks to bring the same model to 10 communities in LA Sierra Tarahumara. 10 telemedicine modules will be installed, equipped with satellite internet, TytoCare medical technology, and the resources needed to provide safe and reliable consultations. The modules will be operated by trained local personnel and connected with physicians from the regional health jurisdiction. In this way, each community will have a nearby point of access for care, diagnosis, follow-up, and essential medicines. The goal is to provide approximately 12,000 consultations each year, benefiting 12,149 residents and reducing patient travel by 40%. The total investment required is USD 95,037. But this project is not about delivering equipment that will later be abandoned. Its sustainability is built on clear and concrete responsibilities. Ministry of Health professionals will provide consultations and medical follow-up. Personnel in each community will be trained to operate the devices and follow care protocols. Each institution will appoint a person responsible for coordinating the project. In this way, the modules will remain operational through local capacity, technical support, and long-term institutional commitment. Health for All does not seek to replace doctors or solve every healthcare challenge in La Sierra Tarahumara its own. It seeks to remove one of the most unjust barriers, allowing distance to prevent people from receiving timely care. 10 modules can mean thousands of timely diagnoses, treatments that are not interrupted, and families who no longer have to choose between undertaking a difficult journey and going without care. Because healthcare should not depend on where we were born, how far we can travel, or whether we can afford the journey. Through this project, technology can reach places where a doctor cannot yet be physically present, transforming waiting into care, distance into connection, and isolation into hope.